I came to McAllen 6 years ago as a pediatric hospitalist, and after spending some time here, I really found it to be a very nice place, a place that I wanted to raise my family in, and thus I decided to go ahead and open my practice. From the beginning, I have tried to keep everything absolutely electronic, which fortunately I've been able to do. I chose pediatrics after 1 year of family practice, because I realized that they were really the best patients. Everybody around kids is just happier. It's just a different environment in medicine. When it comes to patient care in pediatrics, a lot of details make a big difference. I do take my laptop into the rooms, which allows me to show patients growth charts, allows me to look back at previous visits. Okay, so he's doing pretty good. Take a look. When I was a hospitalist, it was very hard for me to get the full picture on the patients that were being sent to the hospital because there was lack of information from what had happened in the clinic, perhaps in several visits before. So I take my computer with me for that purpose. At the click of a button, I can see all my previous visits, and it might become pertinent to that particular visit that I'm in. That's perfectly fine. Some of the doctors that have never experienced EMR or have very limited experience, they feel like it's only a burden. But if they only realize that you can copy and paste, you can pull pre-completed notes from your files.
Oh, that's beautiful. Okay, let's do it.
So when I do a pre-completed note, something that is pretty standard in my practice, it might take me a minute or two at the most to complete the entire chart with a pretty decent amount of documentation. When Dr. Wells joined me earlier this year, she had come from her practice of 25 years of doing paper only. She was used to finding vaccines in one page of the chart, writing in another part of the chart. The laboratories would be in another section. She was used to that.
And another deep breath.
And when she came here, she had the good attitude of just wanting to learn Cerner.
I was making a clean break with the paper, and I knew I had to do it. Plus, that's the way it is. That's the government wants us to do it that way.
And we were being chased by a ferocious carnivore.
Within probably a month or so, she was a master at it.
I'm very obsessive compulsive about I want every little detail in my notes.
And there it is. Okay.
Wicked.
It's wicked looking.
But now, when I've asked her how she's doing and how does she like the system, she tells me she would not go back. Anything in life, when you're new at it, it's a little bit more difficult. But if you put your mind to it, I think you can easily learn it. And Cerner is one of the most intuitive programs that I know.